Almost every second person experiences back pain at least once every year. It's extremely common, and now I will explain how to fix it using simple methods. The pain usually builds gradually during the day. It often feels worse after long sitting or static posture, and sometimes better with movements, walking, gentle stretching, or lying down. This happens because prolonged sitting overloads the back muscles, ligaments, and facet joints. These structures are forced to carry more load than they were designed for. At the same time, local blood flow decreases, muscle becomes fatigued, microinflammation develops, and inflammatory mediators begin to stimulate pain receptors, and we feel pain. This condition is called mechanical or postural low back pain. The second most common scenario is disc-related pain. This is when person says, something shot in my back. This pain usually sharp stabbing or electric, and it often travels down the buttock or into the leg. Coughing or sneezing can cause sudden severe pain. Sitting usually makes the pain worse. This type of pain requires more attention. It most often begins after strain or sudden loading. With age and inactivity, the intravertebral disc gradually lowers water content, and it causes a decreased elasticity, and outer fibrous rings weakens, a small micro tears develop, and after sudden load, such as lifting, bending, twisting, causes excessive stress on the disc, and gel-like center of the disc, called nucleus pulposus, is released, and it bulges outward or herniates, and it causes irritation of nerves, and it causes pain. And third most common back pain scenario is age-related degeneration. It's after 60, morning stiffness, pain loosens after movement, discomfort that worse after being standing or walking, and aching pain, not sharp, not radiating, not electrical. It happens because with age, intravertebral disc lose height, and it causes mechanical load shifts towards the joint, and it causes facet joint osteoarthritis. Now I will tell you how to protect your spine correctly. The first and most important exercise is a front plank. It prevents low back pain. You should perform 3 sets, holding each about 45 seconds, and gradually progress to 1 minute. You must stop before shaking begins or before lower back starts to sag. The front plank activates deep stabilizing muscles. These muscles work as natural corset, and it protects your back during sitting, walking, lifting, or even during sudden movements. This one exercise can reduce back pain and its recurrence almost 50%. It is one of the strongest non-drug methods we have for back pain protection. The second exercise is side plank. You should do 3 sets, holding 20 to 40 seconds each side. If you need, you can start with knee bend, because proper form matters more than duration. One side plank stabilizes lateral core muscles, and it prevents side bending collapse during standing, walking, or standing on one leg, or carry bags, uneven loads. Actually, these weak lateral stabilizer muscles are very common hidden cause of chronic low back pain, especially people who walk a lot or sit asymmetrically. This exercise can reduce back pain around 40%. And the third exercise is gluteal muscle strengthening. The gluteal muscle are the primary hip extensor and stabilizer. Almost 80% of people with low back pain have weak gluteal muscles. Strengthening them can reduce low back pain nearly 50%. When these muscles are weak, the lumbar spine compensates. As a result, facet joints and intravertebral disc receive excessive load. That overload gradually leads to pain. Gluteal bridge is most important here. You lie on your back, knee bend, knees bend, feet flat on the floor. Gently brace the abdomen and squeeze the glutes. Lift the hip until the trunk and tight align. Hold for 3 to 5 seconds, then slowly lower. Perform 3 sets for 15 repetitions every day or every other days, and rest for about 60 seconds between sets. And fourth important exercise is hip hinge. This is a movement where spine stays neutral and straight, and motion happens at the hip joints. It's very important exercise because it protects your spine and it drops load about 40% on your spine during the bending or lifting. This movement patterns is crucial for when you pick something up or lift objects or bend during daily activities. Stand tall with feet hip wide apart. Place your hands on your hip. Slightly bend forward. Bend at the hip, not squat. And push the hip straight backward. Keep the chest proud and the spine neutral. Stop when you feel stretch in the hamstrings. Perform this set 15 repetitions and 5 times per week. If you want to recheck your technique, just stand about 30 centimeters from a wall. Try to touch the wall with your buttocks, not your back. If you succeed, you are hinging correctly. And the last component for your back is ergonomic sitting. It plays important role protecting your back and reduce spinal load. The most important element is lumbar support. It should be support spine at L4, L5 level. This is lower part of your lumbar curve, located just above the buttock, not high in the mid-back, and not directly on the tailbone. This support should fit into neutral inward curve. Top of the screen at the eye level. Screen distance should be your arm's length, and it's called good ergonomics. It can reduce pain severity. And also you should remember, walk around 45 minutes per day. Break sitting every 30 minutes. Aim 8,000 to 10,000 steps daily. Perform core endurance exercises every day. Do gluteal strengthening exercises 3 to 5 times per day. And maintain body mass index below 30 and ideally below 25.